Okay, so Mental Health and Learning Disabilities Week 7, this is the lecture flashcards. What percentage of male and female prisoners have 2 or more mental health difficulties? Males 72% and females 70%, so you can remember that was around 70. What social risk factors are associated with both mental health difficulties and learning difficulties and imprisonment? High psychosocial deprivation, family history, and childhood histories of significant emotional and behavioural difficulties. Why is it important to understand the risk factors associated with imprisonment? To understand the offending behaviour, to help manage prison life, and to engage in interventions designed to reduce offending behaviour. What are the steps within the justice system that precede custody? Prevention, final warning and reprimand, community penalties, and intensive supervision. What is the definition of a youth offender? Those between the ages of 18 and 11 years who have committed a criminal offence and have been given a non-custodial or custodial sentence. What percentage of crimes are committed by young people? 25%. How much money per year does rehabilitation and reoffending prevention save the government? 80 million. What is a community sentence? When someone has to participate in a youth offending programme and comply with the programme's restrictions, so for example a curfew. What systems support young people with custodial sentences? Youth offending institutions. Which systems support young people with community sentences? Youth offending teams and intensive surveillance and supervision programs. What links have begun to emerge between poor language and communication and youth offenders recently? Children with speech, language and communication needs are more likely to develop emotional and behavioural difficulties. Children with emotional and behavioural disorders have unrecognised speech, language and communication needs, and there's a high prevalence of speech, language and communication needs in young offenders. Which government review recommends that speech and language needs of young offenders should be a priority? It's the Berko Report 2008. What did the Berko Report 2008 suggest? That speech and language needs of youth offenders should be a priority. Rutter et al. 1998. 1988 even. Language difficulties may cause behavioural difficulties and vice versa. That's the same one. Redmond and Rice 1998. Model of social deviance and social adaptation. What is the social deviance aspect of Redmond and Rice's 1998 model of social deviance and social adaptation? that behaviour is caused by the psychological traits, as evidence shows similarities within the psychiatric population. What is the social adaptation aspect of Redmond and Rice's 1998 model of social deviance and social adaptation? Behaviour is a result of how the child compensates for their language and learning difficulties. Tomlin, 2000. Said it's more likely that mediating variables confound the relationship between language difficulties and behavioural difficulties. I think that's meant to be compound, not confound. Who disagreed with the written 1998 to say that it's more likely that mediating variables confound the relationship between language difficulties and behavioural difficulties? Tomlin, 1998. How might meeting the language and communication needs of young offenders influence reoffending rates? By increasing engagement with youth rehabilitation programmes, by communicating with caseworkers, and by aiding participation in education programmes such as learning to read. What are the two ways that SLTs can meet the speech, language and communication needs of young offenders? They could train staff to understand the speech, language and communication needs and communicate more effectively. Or they could work directly with the young people to improve speech, language and communication. Gregory and Bryan, 2011. And this is a study of language intervention for those on an ISSP. It found a high percentage of language difficulties and some improvement after intervention. What is an ISSP? An intensive supervision and surveillance programme. What percentage of young offenders on an ISSP did Gregory and Bryan 2011 find have had language difficulties? 65%. Who did a study of language intervention for those on an ISSP and found a high percentage of language difficulties and some improvement after intervention? Gregory and Bryan, 2011. This is Gregory and Bryan 2009, not 2011. They did a case study of a 14-year-old youth offender who had speech and language therapy in individual sessions and joint sessions with their caseworker. What was the profile of the participant included in Gregory and Bryan's 2009 study? Was a 14-year-old prolific and persistent youth offender with low academic attainment and parental drug use. What were the aims of the Gregory and Bryan 2009 intervention? They have aimed to speak calmly and to speak clearly and express himself more calmly. What were the outcomes of Gregory and Bryan's 2009 intervention? Showed progress with social communication, and the ISSP manager said he was much warmer and willing to listen and more approachable and enjoys interaction. What are the limitations of findings of speech and language therapy interventions with the use of youth offenders? Interventions have improved language ability but not proved that they've reduced reoffending rates.